this is a topic that is particularly novel, at least to the editorial team in terms of our coverage, but obviously is growing in discussion and audience interest. So we got one of the best experts in the field here today to talk to us about it, and that's Dr. Ken Ataga. Dr. Ataga is from the University of Tennessee Health Science Center. And before we get into some of the data that very recently came out pertaining to sickle cell disease and some of our understanding behind the mechanisms, Dr. Ataga, how are you doing?
I'm good, thanks. How are you?
I'm doing well. And once again, thank you so much for joining us end of Friday. I'm sure you have a lot more interesting things on the mind right now, but nonetheless, this study that we're referring to is just incredibly interesting. We'd love to learn a bit more about it and see how it informs the field, right? So the piece I'm referring to, of course, it's the low hemoglobin increases risk for cerebrovascular disease, kidney disease, pulmonary vasculopathy, and mortality in sickle cell disease. And this was a meta-analysis published in PLOS ONE back in April. As an author on it, Dr. Ataga, can you tell us first and foremost a little bit more context behind the research and what led to this study?
So we have, so thank you very much for having me today. So for one, so I'm a hematologist and I take care of patients who have sickle cell disease. And over the last several years, decades, we have had an increasing understanding of the pathophysiology of sickle cell disease. And there's increasing recognition that anemia is associated with several problems in these patients and appears to play a role in the pathophysiology of a variety of complications in patients with sickle cell disease. And so there have been several individual studies that have looked at the relationship between anemia, that's low hemoglobin, and a variety of complications. And so we thought we should kind of pull together these studies and perform some kind of systematic review and meta-analysis of these studies to see what we might find with regards to the relationship between anemia and complications of sickle cell disease. So that's why we embarked on this study.
That's very interesting. And what were some of the, I guess, to put it into different terms, the headline findings? What were some of the most impactful findings you guys had?
So pretty much as the title states, so we did find a significant relationship between anemia, that's low hemoglobin levels, and several complications, including chronic kidney disease, manifest clinically as albuminuria, which is increased expression of albumin in the urine. Also found a relationship between low hemoglobins and risk for stroke and stroke in patients with sickle cell disease. Found a relationship between low hemoglobin level and estimated pulmonary arterial systolic pressure, which is kind of a surrogate and a predictor for a complication called pulmonary hypertension in patients with sickle cell disease. And perhaps most importantly, found a relationship between low hemoglobin levels and increased risk of death in patients with sickle cell disease.
Wow. And of course, this influences so many different facets of, overall care for sickle cell disease and in terms of diagnostics, progression of therapy, and even start of therapy. Do we imagine that this would influence any of these pathways more directly in terms of where a patient is in terms of their progression?
Yeah, so I think, so that's actually a good thought. So I think clinically, those of us who take care of patients with sickle cell disease have always noted that there are some patients who have particularly low hemoglobin levels who seem to have a higher risk of having certain complications. So in my practice, for example, I have a few patients who have particularly low hemoglobin levels, who have fewer episodes of pain, pain being the most common clinical manifestation of sickle cell disease. But they have a high risk of having more other problems like kidney problems or leg ulcers and so on and so forth. And so one of the things we did in this study was that with the meta-analysis, we also modeling that looked at the effect of increases in hemoglobin levels from baseline. So that if patients had increases in their hemoglobin levels, what effect might it have on these complications I kind of talked about, as well as what effect might it have on mortality. And we did find that when patients had improvements, they had increases in hemoglobin levels of at least 1 gram. They had significant reductions in risk of having stroke, risk of having pulmonary hypertension, or estimated increases in what we call TR jet velocity, which is a surrogate for pulmonary hypertension. I also have a reduction in risk of kidney disease, as well as a reduction in risk of dying. So that does offer opportunities for the conduct of trials looking at medications that can increase hemoglobin levels to see what impact those medications might have.